Sir, I feel that I am forgetting everything that I read in the past. Sir, when I go to the next subject, I forget everything about the last subject. I feel that on the day of the exam, I'll perform very badly. I feel that everybody else will get great ranks, they will get into good colleges, will get great branches. I would be the only one left behind. Sir, my family members will laugh at me. I'll be facing a lot of taunts if I do bad. All these questions are sent to me by students across the country almost on a daily basis. They are struggling with these thoughts, they are struggling with these ideas. So, what should they do? Before I attempt to answer these questions, I'll tell you a very short story. Many years back, when I started my clinical practice, I saw a patient. A patient came to my clinic and he was telling about himself. And I still remember one of the sentences that he said. He was a very rich guy. He had tens of crores of rupees in his bank and had multiple properties, was driving a big car. And he told me, Doctor, I have enough money. One day I was calculating and I calculated that for the next 15 years, even if I don't earn a single more rupee, and if everybody in my family spends, a lot, lives a luxurious life, even then for the next 15 years, there is no problem of money. But doctor, I am very scared. A thought keeps on coming in my mind that what will happen in the 16th year. These were his exact words. That patient had generalized anxiety disorder, and this thought, which may appear very weird to you, that a guy who is so rich that who does not have to work at all and spend freely, still does not run out of the money for next 15 years. Why is he thinking about the 16th year? But this is what anxiety does. Anxiety shows us the worst case scenarios and presents those scenarios to us as if they are about to happen. The anxiety thought of that person who had GAD is not very different from the anxiety thoughts that our students come up with. This thought that I forget everything that I study. I do not remember anything from the last subject. I will forget everything on the day of the exam. These are also anxious thoughts. Your mind is showing you the worst case scenarios. It is making you believe things that do not exist. So, if you are one of the person who is struggling with these thoughts, what should you do? The first and the foremost, the crux of the cognitive behavioral therapy that we do in patients with anxiety and depression. You may not have anxiety disorder or depressive disorder, but all of us can feel anxious or depressed at times, non-clinical or subclinical symptoms. And for us also, CBT works pretty well. What is the crux? Just because I had a thought in my mind does not mean it's true. Just because I had a thought in my mind does not mean it's true. Just because you had a thought that you have forgotten everything does not mean that you have actually forgotten everything. Just because your mind is telling you that when I go to the next subject I forget the last subject completely, it does not mean that you are forgetting everything from the last subject. This is just anxiety playing with you. So first thing, just because I had a thought, I am not going to accept it at the face value. You have to tell yourself that just because I had a thought, I am not going to accept it at the face value. What is the second step? If you're still getting these thoughts, you can ask yourself, what is the basis of this thought? Say you had a thought that I forget everything that I studied in the past. Ask yourself, is that thought really true? Do I really have any evidence to back that thought? And then you think logically. You think about probably 10 MCQs that you tried doing. Maybe you had forgotten 6 out of them and remembered 4 out of them. Even that does not mean that you have forgotten everything. Even if you are able to recall just 40% of the course, that does not mean that you have forgotten everything. That is the evidence against your thought. Right? Then why does it happen that we start getting these thoughts? These are called as cognitive errors. One of the cognitive error is overgeneralization. Say you are studying orthopedics and the last subject you had read was dermatology and you saw 2 MCQs from dermat and you could not answer them. Now your mind goes into that overdrive, that cognitive error of overgeneralization starts playing up, and just on the basis of 2 MCQs you say, I have forgotten everything from dermatology. You are overgeneralizing. 2 MCQs are not equivalent to the entire subject, but your mind is overgeneralizing, right? And then there may be what is called as catastrophization. That if you are not able to answer 1 MCQ, your mind tells you, in the exam also I would not be able to answer any MCQ. Catastrophe. right? Something really bad is happening. This is also nothing but a cognitive error. So we have to learn to stamp our thoughts also. When you get this thought that I cannot remember anything, tell yourself, I am overgeneralizing. This is nothing but overgeneralization. When you're able to stamp it, when you're able to label that thought loses all its power. Otherwise, what happens? Say you are studying orthopedics and the thought came that I cannot remember anything from dermatology. Immediately what you feel is you're feeling anxious, you're feeling keyed up, you're feeling worried, and you're not able to concentrate, you're feeling restless. Rather than focusing on the studies, you start doing something else. All these thoughts are very powerful. They will impact your motivation levels, they will impact your behavior, they will impact everything. They impact your body also. You start having palpitation, you may start feeling sweaty. So these thoughts are very strong, and when we label these thoughts that this is overgeneralization, or when we say that this thought is not true, or when we do that thing, what is the basis of this thought? Then you take the power out of these thoughts, and then these thoughts are not able to trouble you. So do that. If such anxious thoughts are troubling you repeatedly, say that just because I had a thought does not mean it's true. Label it. Say that this is catastrophization, this is overgeneralization. And still, if you are getting pounded by these thoughts, one of the technique is to just distract yourself. There's a technique called as grounding technique, in which what happens is, say I'm studying and I'm getting all the negative thoughts. So what I do is, say I'll start saying that I'll name 5 things that I can see. Let's say there's a television, there's an air conditioner, there's a water bottle, there's a camera. And then I say that, let me say 4 things that I can touch. I say I can feel the t-shirt I'm wearing, I can feel the table, I can feel the chair. So when you start saying these things, basically what is happening is the chain of thought that was developing, you bring that chain of thought to a halt. So that building of one anxious thought, second anxious thought, third anxious thought, you are able to halt it, you are able to stop it. So you can do this: 5 things I can see, 5 things I can smell, 5 things I can touch, right? So block that, or you interrupt that chain of thought, and you feel a bit better. Another good technique is what we call as worry time. So what is worry time? You are getting all these thoughts, what to do, what not to do, I will forget everything, all of that. You tell yourself, okay, all these thoughts, I will think about these thoughts at the dinner time. Let me just write down on a piece of paper. You just scribble down something, and you tell yourself, all these thoughts are okay, they are coming in my mind. I'm not going to think about these at this point of time. I will think about these when I sit down for the dinner. So in dinner time, 30 minutes is your worry time. All you want to think about these imaginary scenarios, you think about those things at dinner time. This is called as the concept of worry time. When you prepare for entrance examination, getting control of your thoughts is very important. Students who are consumed by these thoughts, who keep on thinking about these things, who keep on indulging in overthinking, end up wasting a lot of time. And not only that, the motivation goes down, the efficiency goes down, the concentration goes down, right? So what is going on in your head has a huge impact on what you are able to do. So we need to get a hold on our thoughts. We need to develop techniques when anxiety starts taking over, and these things do not develop suddenly. You'll have to build upon these things gradually. You'll gradually become better at controlling your thoughts. It's not going to happen overnight. And still, if these thoughts are too many, you feel a lot of somatic symptoms, you just cannot control these things, then probably meeting a psychologist or a psychiatrist is what you must do, right? So I hope you would be able to handle these thoughts in a better way, in a more logical way, in a more scientific way, and that is definitely going to help you better your studies and perform better in the exams. All the best. May God bless you all.